To fabricate a screw-retained prosthesis, like a Toronto bridge, we can use, for example, high burnout copings with the high head connecting screws or the titanium copings, and of course we need also a denture wax-up and a silicone key that reproduces its dimensions. For fixed screw-retained prosthesis, we have to calculate the extensions of the prosthesis. We mark the extensions on the master cast. They will guide us during our project. Here we decide to work with high burnout copings. We screw them onto the master cast without over-tightening the screws. Position the silicone key, mark the appropriate heights, and shorten the copings as necessary. We seat the silicone key back onto the dental cast. In doing so, we create a kind of mold. At this point, we pour casting resin into the mold. The result is the ideal shape of what we have to fabricate. Now we reduce the wax framework until it reflects the shape of the teeth in the reduced form. Also, the flange has to be cut back to allow easy access for patients' oral hygiene. Once finished, the trimming and shaping of the framework, due to the resin shrinkage, we need to separate the framework between the implants and join them again together, one at a time, in order to obtain a passive framework fit. After casting, we need to clean and polish the structure and check the passive fit. To do so, we seat the structure onto the abutment analogs and fix it with the connecting screws. The part of the structure next to the gingiva has to be polished to a very smooth and shiny finish. And we prepare also a kind of chamfer at the transition between the metal and the resin. Then we remove the teeth from the prosthesis, knowing that their dimension and aesthetics are fine, and place them into our silicone key. Before sandblasting the structure, we have to protect the shiny portion and the connecting elements with some wax. Afterwards, we use an opaque and we polish the opaque structure back onto the abutment analogs. We complete all the other teeth and fix them with resin. Once finished, we check again the spaces for the patient's hygiene. They have to allow easy use of the proxy brushes. The finishing next to the gingiva has to be very shiny to assure that food residue can be removed easily.